now. I invite all the speakers of this first session to come and sit here. Are we all here? No? Here. Okay.
Just one little thing. Actually, there's for each roundtable, both sessions has to come, not just this session. So it's health and the next session is training, I think. So please come. I think most of the seats are taken already. So we're supposed to be 9 persons. You will have to. Sorry.
Yes, thank you. So, sorry. I choose a team. I don't know if no, it's not on the screen. For this roundtable, to talk about the impact of the serious games technologies on gamers' health. Is serious gaming a new hazard? It was my question. And my question to you is that can you think about your projects you presented or you will present after, and think about what collateral risk do we create with this new manner to manage health problems or difficulties. Most of the projects we see today are aimed to sensitize the player to take care of himself, to stay healthy. New technologies bring opportunities, but also bring new health risk. If I think about your last presentation, for example, it could be very stressful at the end, and you create new phobia, new troubles, psychical troubles. Is that something you are aware, and do you manage to communicate about this and to cope with this? Perhaps, Adam, you can be the first because you
singled me out. Hi. Yes. Okay, cool. So yeah, just to reiterate, of course, again, it's a commercial video game, not yet a serious game. That said, it is a very important question. I think it stresses the importance of working together with your target population, and that includes both in the cases of, I think, most of the talks where we're thinking about patients and their healthcare providers. Right. So for me, when you're designing a game that you want to help population, and it's a very sensitive population for physical reasons like with a stroke or for psychological reasons, you really want to have the people that you're targeting involved in the design process so that you don't cross those lines and that you incorporate that feedback.
I would like to emphasize on that because if you make any claims that your device or your system or your games will increase patient health or like even like claims, you should be very aware that you need to have some certification to be able to do those claims. I take the example of Lumosity, for example, which were doing some like brain game like Dr. Kawashima, and they were saying that it might improve your cognitive capacity. And they say, really, it might improve. And they get sued like by the FDA for like several million of dollars, like just because they say that it might help you. So be very careful about that. And during the validation process and the certification process, like as we've seen, for example, with our My Mission Go, which was like more like commercial system and even more with our own system. Like the real first step about like this certification is risk analysis. Like we have to provide like a full coverage of like the different risk that bringing like this new technology and this new change of paradigm of interaction. So this is very crucial topic to.
Just briefly add to that, really briefly. Absolutely, totally on board with that. So my advice would be to anybody going out doing that validation, which is essential. Absolutely agreed. Also, try to get a third party involved. Right. It's so much stronger when it's a university or a researcher who has no ties at all to your product that's doing the validation, and do solid randomized control trials, pre-register them. That's the route to take.
Other experiences or comments about how you manage this?
Yeah, well, I don't know about our project, but I'll try to broaden maybe the team a little. I guess that's so in Switzerland in 2017, the public health department published the mHealth recommendation. That is the mobile health recommendation. It's kind of linked to what we're talking about because it's integrating more and more connected objects or anything that is technology related into health processes. And I guess that we don't need to choose whether technologies or serious gaming are bad or good or dangerous or not. In the absolute state, I guess it's always relative to what you do with them, the kind of game that you develop, how you develop it, how you see the people like us. And I guess that the question whether it's dangerous or not, and the question whether we want a society in which there's more and more technology in health, is definitely not for us to decide. And I guess that there must definitely be a democratic discussion about whether we want to bring more and more technology in health or not. But I think that there's a great danger into trying to decide whether or not it is by nature good or bad or a good thing or not. That would be my.
I thought about. Do you hear me? Yeah. 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 I thought about repetitive movements with these technologies. For example, if you only talk about the mobile phone, you only do this with your thumb. We are not created for only doing this. So that's why I asked this question. It's not a political one. It's how you sell your business, taking care of this.
Yeah.
And I think there is really a real challenge there for you to grow and to expand on the world. Yes, please.
So it's pretty hard for me to talk about something I have not yet presented, but my project will be about some kind of virtual reality application in which we manipulate the relationship you have to a virtual body. And I completely agree with you, because such manipulations, we don't really know what kind of effects it has on our brain. And this means we'll have to be very careful about what is the reaction on a short term and also longer term. How having a short manipulation of your relationship to a virtual body can influence your everyday life. So that's something interesting.
Thank you.
Yeah, same for me. I didn't present yet, but maybe I try to just explain in a short sentence. So we are working on an adaptive fitness game environment for children and young adolescents. And we also integrated the target group into the design process, which is very important. At the same time, it's very important to integrate experts from the field of sports science, in this case, into the scenario in order to avoid complications like you're talking about. So experts who know which movements you really need to do a healthy sport like extra-game play.
Perhaps in the public, you have some comment or experience to share? Yeah.
A question for the Mind Motion creators. Did you try the game on elder people? I mean, people who probably never used a serious game or a video game.
Yeah, me, I'm using it a lot every day. No, but yeah, it could be quite boring for a patient, for a person who doesn't have a stroke or, I mean, yeah, it's difficult to say, but it's really tailored for patients. So patient has very limited. We need to really focus on certain movement and to have very not high demanding cognitive tasks. So it's why it's very simplified at the maximum to really help the patient. Ah, okay, sorry. Old. Certainly, I think I don't have any feedback, but I'm pretty sure in center that tried it, but not for. I mean, not. I don't know. That depends what the disease, if there is a disease, or if it's only for motor training. So, so not from my. I have no idea basically, but.
From my personal experience of a subject, like I think the elderly population is often seen as a population which has like some disability to access technologies. The interest we have, like especially with our system, is using natural interaction. So it's really movement you perform with your own body, not through a keyboard or the gamepad that is doing like an interaction on the action you take. So the elderly person are like quite able to adopt this kind of games and motion. We see the Wii, for example, it was like really used in some elderly like hospital and places.
So there's nothing to do with what I present here, but I've been working at the Clinic of Valmont, and the ergotherapists, I don't know if that's how they call it in English, they used to use the Wii, the Nintendo console, and it worked for what I've seen. When I was there, it worked very well with patients that were pretty old, and they had lots. I mean, they really enjoyed doing it, I think, and they thought it was very funny, and I didn't see any particular difficulties, because they were like not fluent in technology. But that's very little experience.
So in Germany, they still already have kind of championships in senior homes. They play Wii bowling against each other. It's in Ulm, for example, so they seem to have fun playing games.
Thank you. We opened the theme because my question is quite responded. You have other questions, or thank you?
I have to comment about this question of having risk by gaming. Or in fact, I want to. My first comment is that everything is a question of advantage and disadvantage. Even drugs, even medicines have qu'on appelle les effets secondaires, side effects, and we use them because it's a question of proportion. If we have good effects and we have small side effects, so we have to make a choice. And this is also for we can apply this theory for games or for using any technology. It's a question of proportion. And I think, as one of the speakers says, people are using them. So I think the question is not if we have to use them or not. It's a fact. They are using them because they are funny, attractive, and they have positive sides. So the question is, how can we reduce the side effects or the negative effects? And I think this is not a question only for game designers. It's only a question for therapists, ergonomists, many other domains. So it's a question of reducing that. We have the same problem, for example, for cars. Conductors have negative effects, but we will not stop any transports because these side effects. So we have to tackle the problem in order to reduce that, but we cannot stop evolution, emerging of technology and use of technology. So this is my comment.
Thank you. For cars, for example, if you take a car from 100 years ago, we improved them to be less pathologic for the position of the driver. So that's why I think we are in the first steps of these improvements for this technology, that it's the quotidian one. You want to add something?
Yeah, and this is why we are moving with. Yeah, I totally agree with you, and this is why we have an emerging domain in HCI, human-computer interaction, what we call natural interaction, natural human interaction. So we try to use as much as possible natural interaction by jest, by vocal, voice, because it's more natural, and it requires less repetitive movements or any the constraints of using any device. So this is a tendency, but we are at the low stage, at the beginning.
Thank you. Yes.
So I'd like to get back to what you say at the beginning. You were talking about is making these movements really good for. We are not made to do these movements. There is a famous epistemologist who's, I think it was in 1975, who wrote "Practice Make the Pertinence," and it comes to the question: what is important for us? What is pertinent for our practice every day? And about the risk, we need to see what we. Maybe I will make it in French so it's clear. But la question c'est la suivante en fait. Pourquoi est-ce qu'on est fait en tant qu'être humain? Quel est notre objectif? Et vous avez dit au départ, on n'est pas fait pour faire ça. Mais on est fait pour faire quoi au final? Et peut-être qu'au travers de... C'est une question qui est un peu particulière, mais la pratique fait la pertinence. Et donc si maintenant la pertinence, c'est de faire ça pour pouvoir progresser et qu'on se transforme là-dedans, alors pourquoi pas au final?
Yeah, you think about human evolution and how we are like we are today and not when we were in our caves. But the physiological evolution of human is not 100 years step. It's a huge amount of 1,000 years for having one change of our physiological status. Sorry, I'm not. You understand? So it's saying that we will be adapting to this and evaluating that we will develop muscles and things with our thumbs, for example, is it's too quick to be effective. Exactly, the time scales are not the same.
So maybe I did not really understand what was your point by saying that we were not made for this.
We are made to run, to hunt, to be outside, not on the computer 8 hours, 10 hours or more in the day. That's why what I was saying. Physiological, we need air, we need see the sun and these kind of things. So that's what I meant. Is it okay? Other inputs, comments? No? You want to add something? Okay. So I think we will have a break now, and we will be back in 15 or 20 minutes, I think. Thank you very much to all.